Welcome to the third part of the trauma to the trunk and pelvis section of this series. So if you've been watching these in order, you know we talked about trauma to the trunk. We've already talked about chest trauma, abdominal trauma. We still have to talk about trauma down to the pelvic area. So that's where this section is gonna focus specifically on both pelvic trauma as well as trauma to the GU structures, the genitourinary structures. The best location to assess for costovertebral angle tenderness is A, in the mid-back below the scapula, B, along both flanks above the iliac crests, C, directly below the rib cage lateral to the vertebral column, or D, over the 11th and 12th ribs where they meet the spinal column. Pause if you need to. I'm going to move on now. All right. So the main structures of the genitourinary system are the kidneys, the ureters, the urethra, and the bladder. 84% of trauma to the GU system will be to the kidneys. Hardly ever to the ureters. The ureters are deep in the abdomen. They're well protected. It is rare to injure the ureters. If they are injured, it's almost always due to penetrating trauma. The kidneys are positioned close to the spleen, the stomach, the jejunum, and the pancreas. So anytime those organs are injured, always have a high index of suspicion that the kidney was injured as well. The kidney is relatively mobile. It's not fixed much. The renal artery and vein that go in the front of it are fixed, but the kidney is somewhat mobile. It's just kind of packed behind the peritoneum and kind of held into place. So because of that, it can be injured fairly easily, especially in rotational type traumas, where like a car spins or rolls. That kidney gets moved around back in there and can be easily injured. It rotates on the pedicle, because remember, the renal artery and vein, the pedicle, are fixed, but the kidney isn't. So as you move around, your kidney moves, but this doesn't, so you get the injury between the two. You should always suspect kidney trauma anytime you have fractures of ribs 10, 11, and 12, especially in the posterior area, or fractures of T12, L1, L2, because that's just where your kidneys are. Your kidneys are actually pretty small. They're little beans that are underneath ribs 11 and 12, and right next to T12, L1, L2. So those fractures may affect the kidney. Of course, any penetrating trauma to the trunk should always have a high index of suspicion for kidney involvement. And the kidneys are more mobile in the pediatric patient, therefore they're at a higher risk for kidney injury. Again, I've given you the grading of kidneys for your reference. My experience with the test is this is not testable, but I could be wrong. You may get a test question on it. I can't say for sure, but I've never seen it. But the reason I like this set of pictures is because you're going to notice if you look at grades 1 and 2, if you can see the pictures, notice how there's bleeding to the outside of the kidney and blood is accumulating in the capsule around the kidney. But the renal pelvis, the inner part of the kidney where urine is made, is not affected. In 1 and 2, it doesn't go into the renal pelvis. The blood just escapes out and collects around in the capsule around the kidney. And so the urine making apparatus isn't even affected until you get up into grades 3, 4, and 5. In those higher grade kidney injuries, the injury will extend down into the renal pelvis. And now we're going to start to see things like frank hematuria and alterations in the ability to make urine. But most of your kidney injuries are 1 and 2. So a lot of them don't really get into that urine part of the kidney. Hematuria, though, does remain the leading indicator of kidney trauma. 80% of kidney trauma will have hematuria. Now, in milder cases like a 1 or a 2, it might just be microscopic. You may need to dip for it. In severe injuries, your 3, 4s, and 5s, you're more likely to see that gross hematuria like the top picture. Do note that 20% of patients with kidney injury do not have hematuria. Therefore, the absence of hematuria doesn't rule out kidney injury. It just reduces the suspicion of it. If you do have gross hematuria, like the top picture, do note that it usually decreases about 2 to 6 hours after injury and becomes less severe. The patient may also have ecchymosis. Again, the ecchymosis is going to be near the area where the kidneys are, which is the 11th and 12th ribs in the back. If there's blood accumulating in that capsule around the kidney, you may feel a mass around the 11th and 12th rib. If you palpate back there, you may feel where the blood is accumulating in that capsule. The patient may have flank or abdominal tenderness. You can test for costovertebral angle tenderness. Remember, the costovertebral angle is the angle where the rib meets the spinal column, and that occurs right around, and the kidneys lay under 11th and 12th. So if I want to test for costovertebral angle tenderness, I'm going to gently tap right there where the 11th and 12th rib meet the spinal column, and that's the costovertebral angle. So it's the best place to test for tenderness related to the kidneys. And then the patient can have elevating budding creatinine, of course. So the best location to assess for costovertebral angle tenderness is in the mid-back below the scapula. Nah, that's too high. Kidneys are way below that. Above the flank, along both flanks, above the iliac crests. Iliac crest is a little low. Your kidneys are above that, so B is not right. C, directly below the rib cage, lateral to the vertebral column. No. You want to do it over the 11th and 12th ribs, not below the rib cage. So D is the best answer, over the 11th and 12th ribs, where they meet the spinal column.